Okay, so first we're gonna check your posture, see if there's any abnormal hip alignment or anything like that. And I'm gonna have you stand on one leg to check for a Trendelenburg or a drop of the hip. And then can you close your eyes for me to check her balance? And she starts to wobble just a tad, but so far so good. Okay, now I'm gonna ask you to do a single leg squat. This is the test for any internal rotation of the hip or knee. Good. All right, now can you lay on your back? All right, put your knees up and do a bridge. Do a bridge. Lift your butt up and back down. Good. Now put your legs back down. Check for her leg length, and that looks pretty good. And come up to the pelvic to check her alignment, and that's good. I'm gonna check her pubic bone. That's also good. I'm also going to palpate her pubis, her psoas, and then I'm going to palpate her adductors and also her ITB. Then I'm going to lift her leg up like this. Check for internal and external rotation of the hips. And she seems pretty good on both sides. Then I'm going to check her hamstrings. First I'm going to do the single leg raise. Good. And then I'm going to do 90-90. Next I'm going to do the quadrant test to see if there's any labral tears or impingement in the hip. Good. Then I'm going to ask you to bring your knees up to your chest. For a tonus test, I'm going to let one leg down and see if there's any tightness in the psoas. And it looks pretty good, so you can put both legs back down. Now lay on your side for me, that way. And now I'm going to do the over test and see if there's any tightness in the ITB. Drop your leg. And she comes pretty close to the ground, so that's good. Next, I'm going to extend, AB duct, and internal rotate her leg, and ask her to hold it to check for glute strength. And that's pretty good. I'm also going to palpate her greater trochanter and her ITB to see if there's any tenderness, and that's good. So now I'm going to ask you to lay on your stomach and to further test her glutes. I'm going to ask her to do a single leg raise and her glutes fire before her hamstring, which is good. And also I'm going to lift her leg up for the Eli test, and that seems good. All right, can you lay back on your back for me? Now for the knee assessment. First I'm going to check for the hyperextension, and that's good. Check the other side. That's good as well. Next, I'm going to do the Lockmans to check for the ACL. And that's good. And then next, I'll do the valgus, check for the MCL. Good. And then for the LCL. Good. And now I'm going to check for the patella movement. See if it's low. And that's good. I'm also going to check it at 30 degrees. And that's good. Now I'm going to lay it back down and push it medially and put my fingers underneath to check if any signs for a PF. And so far so good. Now I'm going to do the meniscus, the McMurray's, and just swing your leg like this. And that's good.